The aim of the study was to investigate the unintended consequences of patients having online access to their medical records. In terms of the intended consequences, some patients did find it a more convenient way to access information about their healthcare, but there were some unintended consequences which were quite negative as well. So the first one is that it could impact on patients' understanding of their healthcare. And this could be they could discover surprising information. We had a participant that found out there was suspected breast cancer in their notes, which they knew nothing about. Also, the way the information has been written or the way that the results are presented may not be in a format for patients to understand. So that can cause misunderstanding as well. Also, there's issues around practitioners being able to write their gut feelings in the notes. I think what our paper demonstrates is rolling this out is a lot more complex than the policy actually provides. And whereas these intended consequences are valid aims, there's actually a lot of support that needs to happen to practices to help this implementation.